Hi everyone, thank you so much for coming to tonight's presentation. My name is Jennifer Tran. I focus primarily on the website building of this project. I'm currently a third year student specializing in IDS. Afshana, would you like to go next?
Yes, hi, my name is Afshana. I'm a third year IDS and psych student. And in this exhibit, I focused a lot on COVID cases, trends, challenges, and the overall steps taken to mitigate COVID spreading in Africa by the Africa CDC. Abisha, go ahead.
Hi everyone, my name is Abisha. I am minoring in IDS and interested in international health specifically. And for this project, I focused on COVID-19 responses and some of the critical analysis and critiques that Africa CDC has been receiving. Tanya?
Hi, I'm Tanya. I'm also a third year IDS student focusing specifically on gender and health, and I focused on pioneering organizational structures within the CDC. Sorry, Tawhida, please go ahead.
Thank you. Hi, I'm Tawhida Ali. I'm minoring in IDS studies, and I'm focusing on the trusted travel program of COVID-19. Thank you. Now, I guess now we can go back to Jennifer.
So through the use of infographics, timelines, and hosted on our website, we hope we can provide an interactive medium that allows you to be more informed about what Africa CDC is and the impact it has had as a global health actor. So what is Africa CDC? Africa CDC is a specialized technical institution of the African Union established to support public health initiatives of member states and to strengthen the capacity of their public health institutions to detect, prevent, control, and respond quickly and effectively to disease threats. Overall, Africa CDC hopes to support African Union member states to address inadequacies within public health institutions. So within Africa CDC, they've outlined 5 different pillars for delivering technical assistance. The first pillar is emergency preparedness and response. The goal of that is to ensure effective public health emergency preparedness and response. Pillar number 2 is laboratory systems and networks. Its goal is to strengthen clinical and public health laboratory systems networks through continued improvements in workforce competency to ensure quality and safety. Pillar number 3 is public health institutes and research. Its goal is to strengthen public health sciences and improve public health decision-making and overall to practice to achieve positive health outcomes. Pillar number 4 is public health information systems, which is strengthening information systems that support public health strategies in Africa. And finally, the 5th pillar is surveillance and disease intelligence. And that goal for pillar number 5 is to strengthen the health-related surveillance systems for improved public health decision-making and action. Within each of these 5 pillars, we've also developed infographics that outline the strategic objectives. So for example, when you click on pillar number 1, it leads you to an alternative tab. So for emergency preparedness and response, we've outlined the 5 different strategic objectives that have been stated on the Africa CDC website. For the sake of this website, for the sake of this presentation, we are just going to move on and not go through these pillars just because there are a lot of them. So next we're going through the timeline of Africa CDC. So with Africa CDC, the idea for the Africa's own Center for Disease Control and Prevention was devised in 2013. However, it was formalized after the worst Ebola outbreak in history. So within that, it was established in January 2016 by the 26th Ordinary Assembly of Head of States and Governments and officially launched in January 2017. The hope of the Africa CDC and what the Ebola outbreak highlighted was the critical need for a continental entity for disease prevention, surveillance, and response. And as a result, in 2017, the Africa CDC was officially established. Within the Africa CDC, they've been able to develop policies and guidelines for disease prevention and control, train personnel, provide support during public health emergencies, and coordinate donor agencies and philanthropic entities. So within this timeline, we have implemented different quizzes within it and also just random facts that we found interesting about Africa CDC. So passing it on to Tanya, who's now going to talk about WizzleNet and also the different institutes of Africa CDC.
Yes, so this is one of the pioneering organizational structures that I spoke of initially, and what we wanted to highlight. So RizzleNet stands for Regional Integrated Surveillance and Laboratory Network. This network basically facilitates creating networking among academic institutions, both private and public, centers of excellence, NGOs, civil society organizations, and even veterinary networks, so that all sorts of data that is laboratory generated for surveillance and emergency assets are concentrated in one academic source, and it is integrated or operationalized through regional centers. Jen, if you move down, we have sort of created a quiz about the different regional collaborating centers that Africa CDC operationalizes through, and RizzleNet works through that. Moving on to the institutes, we can jump to that tab. So Africa CDC, within its operational structure, functions through two main institutes. Firstly, we look at pathogen genomics. So the Institute for Pathogen Genomics, or IPG, is a continent-wide leadership initiative that was very recently established in 2019 and works specifically on developing bioinformatics in Africa and coordinating disease control activities such as outbreak detection, enhanced disease surveillance, and monitoring drug resistance. Within their mandate, they have three strategic priorities. Firstly, governance and enabling mechanisms. So under this, they generate and share standards of presenting academic data and public health data that is ethically sourced. And secondly, they move on to mapping the landscape of pathogen genomics, which is basically supporting efficient use of existing capacities. And thirdly, facilitating the implementation of all these variegated demonstration programs, because given that Africa is a large continent, facilitation and implementation does take up a lot of manpower and work. The other institute that we wanted to highlight, which I found very interesting, that we found very interesting, was Africa CDC Institute for Workforce Development. So not only looking at the computational and the sciencey part of it, Africa CDC Institute for Workforce Development was established to strengthen human resource and public health workforce in an effort to transform healthcare leadership in the global south and building a capacity in terms of human resource development and generating the new generation of public healthcare workers that are coming trained from the global south. And as you can see, the little bubble, they provide training courses in proposal writing, leadership, management, and more specialized courses such as antimicrobial resistance or public health surveillance. I think now I'm going to hand it to Afshana.
So this segment of our exhibit focuses on the steps that Africa CDC has taken in order to monitor and prevent the spread of COVID, as well as the steps taken to protect the public once COVID cases were confirmed. So since China is a primary trading partner and could potentially impact Africa sooner, Africa CDC started to prepare for COVID cases as early as January 2020 by monitoring cases in Wuhan. And once it was reported that multiple countries in Asia had confirmed cases, Africa CDC then readied their emergency operations center, and through collaboration with ministries of health and regional collaborating centers, reviewed evidence and practices that would be best used to respond to COVID and began to integrate them into public health policies and actions. So In efforts to support the healthcare systems in order to handle potential COVID cases, Africa CDC helped curate AMSP, which is the Africa Medical Supplies Platform, which is an online platform that allows countries in Africa to have better access to PPE and medical supplies at fair and fixed prices. Jen, if you go down a little bit more. Further down. So here we include a small segment about local actors, and amongst local actors, local public health officials were able to quickly repurpose Ebola protocols and infrastructure in order to mobilize and respond to COVID at early stages of the pandemic. So from this, we can see that Africa CDC has been exceptionally well organized in their response and actions, and this will be further explained by Abisha.
Right, so we're going to take a look at around February 2020. And this is quite notable because at this point, COVID-19 cases had not even been reported in the continent of Africa. But because of developing like global news, monitoring, and scientific research, Africa CDC convened an emergency meeting with all the ministers of health from across the continent. And from this meeting, they adopted a joint continental strategy that had three main goals. So the first was to limit transmission. The second was to limit the number of deaths. And the third was to limit the social and economic harm that COVID-19 may have as an impact on existing endemics in the continent. So from the meeting and the establishment of the goals, we can see that Africa CDC, along with its other members, really understood that in order to combat COVID-19 in the continent, a coordinated and cooperative response was necessary. And in addition to the establishment of the three goals, the Africa Task Force for Coronavirus was also established from this meeting, and it had the main goal of making sure that the strategies developed in the meeting were actually implemented adequately. And this task force was endorsed by member states and the African Union and was validated at the highest level of the continent. This is quite important because this united collaborative effort really helped Africa in terms of taking the precautions to limit the number of cases of COVID-19 in early 2020. And as part of the task force, Africa CDC also supported member states in establishing diagnostic capacities. And this is quite integral because it created precautionary and emergency preparedness efforts in terms of detecting the disease early and finding diseases to combat the outbreak that were to occur. So in February, they initially had 2 diagnostic centers across the continent. However, by the end of March, there were more than 43 that were established. And through competency-based training of member countries, Africa CDC and the member states were really able to understand how to take a handle on COVID-19. So the task force placed great emphasis on training. And this is quite important because, as we all know, in the early stages of 2020, understanding how to combat COVID-19 was a new and emerging subject. And so the Africa Task Force essentially trained healthcare workers and community workers for proficient containment of COVID-19 with information on how to handle this newly emerging and changing disease. So throughout the training, through training, Africa CDC and the task force were able to train 15 African Union member states, and they had specific training on things like specimen transport, referral systems, surveillance, screening, isolation, safe transportation of suspected cases, and provision of testing supplies for selected labs. So I think that the task force you can consider it a success story, considering that it really reflected the country level collaboration and COVID-19 specific training in the early stages of the pandemic. And this really strengthened the rapid containment of the virus. Tanya?
Yes, we have a little video after this. So in April 2020, Africa CDC, in an effort to scale up testing, launched PACT, which stands for the Partnership to Accelerate COVID-19 Testing. And because of this initiative, testing was scaled up from around 600,000 tests per month in April 2020 to almost 3.5 million tests per month in November 2020. We're going to show you the video first, and then I'll continue. It's actually Africa CDC's director in conversation with an academic from the Harvard Institute of Medical Sciences.
Absolutely. I think testing, we are at a better place than we were 1 month ago. That we should recognize that and celebrate that, because as I said, in January and December, we had 0 reagents for testing in Africa. And today, over 42 countries have testing capacity at the central level. We also have a stockpile of about 60,000 tests. Just this morning, when I woke up and the head of the disease control program in Cameroon called me and said, we have a confirmed case, but we only have 100 tests at the Pasteur Institute. I said, relax. The next tomorrow, you get 1,000 tests to support you. Relax. We're sending you 4 more people to train you on prevention, on infection prevention, control, and contact tracing, because this individual is a French guy who came in and attended a funeral, mixed a lot, and so I think our strategy for the continent has been ability to rapidly detect and rapidly to contain. So what you're hearing from me is we've scaled up diagnostics, at least at the central level. I want to underline that from almost 0 countries in January to more than 42 countries there. We've created networks where countries that we do not have will be supported by other countries there. We have a stockpile of those tests there. 60,000 may not be enough, but it's a good start. And we know now the relationship. We've set up a supply chain management system with a group in Germany. So.
So testing basically focused on collecting data for serosurveys. Serosurveys, in layman's terms, is testing and collecting serum, which is a bodily fluid that contains proteins. But more importantly, it contains indicators of antibodies that are indicators of immunity. Serosurveys use genomic epidemiology to better understand how diseases spread to large populations, and are critical because they help us identify how infection spreads, and how interventions would then look like once they're implemented. And such surveys will also help in the next stage of pandemic preparedness by outlining how vaccine deployment would look like by linking demographic data and epidemiological data. So for example, Africa CDC, when they conduct serosurveys and when it goes through their diagnostic process, it is separated through population-based, age-based, and gender-based stratifications so that it is vaccine deployment is appropriate. Yeah, I'll hand it off to Tawhida.
So I'll be going over the Africa Medical Supplies Platform. And this is a very interesting and quite important COVID-19 response that was spearheaded by Africa CDC. So it's the Africa Medical Supplies Platform, which is a COVID-19 Africa pool procurement portal. And this is one of the most highlighted initiatives that's carried out by Africa CDC. And this is because, as we all know, in the early stages of the pandemic in 2020, several countries across the globe faced challenges in having PPE for the frontline healthcare workers. And just like that, Africa itself was really struggling to obtain PPE for their frontline healthcare workers. And the soaring prices of PPE was definitely an added challenge. So in order to be better equipped and prepared, Africa CDC organized an online platform in collaboration with the African Union and their partners. And this platform basically provided immediate access to African and foreign certified medical equipment from vetted manufacturers. So things like the diagnostic kits, PPE, and clinical management devices were all found under one website. And what was really important is that they were cost effective and they were very transparent. So this helped with the ability of African member states to urgently access required PPE for frontline healthcare workers. And it's also quite important to note that the website focused on and gave priority to African-made products and supplies. And this is quite interesting to us because this initiative by Africa CDC is exemplary. And although it feels like such a long time ago, in the first wave of the pandemic, even global north countries like Canada really struggled in obtaining PPE for their healthcare workers. And many wealthy countries paid extremely high prices, and the competition even led to the hijacking of supplies, shipments, right? So this early preparedness and organization and leadership by Africa CDC and its partners showcased that Africa was truly able to find African-based solutions for their challenges. And we're going to move on to September 2020. So in September of 2020, Africa CDC had launched a web-based tool, and this tool was called the African Volunteer Health Corps. And this was in collaboration with international health regulations and the Project of Public Health England. And so this tool basically served as a bank of standby healthcare workers who would then be deployed to countries across the continent based on outbreaks and assessments. And this web tool not only allowed for rapid employment and resources of healthcare workers into regions that needed it the most, it also allowed for the exchange of relevant information with public health partners. And furthermore, really allowed for healthcare workers who were specifically trained with COVID-19 emergency preparedness and management to be deployed into regions that needed the extra assistance. So the volunteer healthcare workers were deployed based on specific country profiles that were also generated from this web tool. And they included things like the risk map and vulnerability assessment, which then guided the deployment and placement of volunteer healthcare workers. Right, Taida?
Yes. So in January 2020, the Africa CDC launched, in conjunction with the African Union, the Trusted Travel My COVID Pass. The Trusted Travel My COVID Pass is a campaign that promotes hassle-free travel across Africa. It also prevents the cross-border spread of COVID-19 infection. Okay, if you can go down. Okay. The Trusted Travel portal was developed by Panabios Consortium and Econet Group as a public-private partnership with Africa CDC. Kenya became the first country in Africa to launch the Trusted Travel platform in order to manage travel during the COVID-19 pandemic. The Kenyan Ministry of Health implemented the COVID Pass tool on January 11th, 2021. Now, the diagram below details the process of the tool, which are in more detail in the video. But the first step is the public health authority sets restrictions and test requirements in the portal. They also register and monitor testing laboratories. The passenger obtains information and goes to a lab to get tested according to the requirements laid out by the public health authority. The lab operator generates special seals for digital test results that are verifiable through the Trusted Travel portal. The passenger can go to the airline's website to validate their test result for clearance code, or the passenger can go to the airport and validate the test result code with the help of the airline agent to obtain the clearance code just ahead of travel. Upon the arrival in the destination country, the port official verifies the clearance code and then allows the passenger traveler through. Machine learning algorithms monitor for fraud or collusion to game the system while blockchain ledgers maintain data integrity. So below is a video with step-by-step instructions on how to access the portal, but we'll just be showing you the video process of how the COVID-19 lab test provider works within the travel portal.
Laboratory services. Laboratory service providers administer relevant tests and generate secure seal for travelers' result that cannot be forged. Log into the Africa CDC Trusted Travel portal. On the dashboard, under Tests, select Seals. click Generate Seals. Fill the traveler's details, then click Next, click the test. On the result, choose either negative or positive, enter your remarks and click Save. On the next page, the list of travelers and their results will be displayed. For airline operators, log into the portal, select departure country and port. Then arrival country and port. Next, click on Get Restrictions and the travel restrictions between the two countries will display. Then click Signing. It will lead you to login page where you input your username and password, and the Africa CDC Trusted Travel Apps window will open. Select the digital test result. On the dashboard menu, select Trusted Laboratories. Select the country, click Find. On the displayed tab, click Contact Some, and the laboratory details will display. Then select Checking, select Departure and Arrival Ports. Click on Next, fill in the traveler's details by clicking the Traveler's Health Form. Click Save. On the next page, select the most recent test taken, click Save and a code will be generated. Click on Download to save the code on your device. The traveler will be required to present the downloaded code to the port health officials at the departure or arrival port, who will cross-match it online before allowing you to pass.
Thank you, Jen. Okay, so as we've seen, the Trusted Travel tool includes the verification of public health documentation for travelers upon entry and exit across borders, databases which include vaccination compliance information and authorized laboratories for testing, health-related processing information for travelers and port officials at border crossings, and the African Union member states supply this information, and the validation is done by Africa CDC. The results of the Trusted Travel Program have shown that the partnership between the US CDC and Africa CDC have assisted in slowing the spread of COVID-19 on the continent of Africa and travelers abroad. Some issues that arise are movements continue across borders in Africa regardless of formal closures, which pose a significant threat to the spread of COVID-19. Certain communities have little knowledge of COVID-19, which risks the lives of the populations along the borders and make controlling the virus difficult. Cross-border contamination can prevent people from seeking treatment due to stigma, which creates issues for those who move across the borders frequently, like truck drivers. Efforts to reduce the spread of COVID-19 should aim to reach out to formal and informal entry points along transport routes, in addition to engaging the local transport operators. The regional collaborating centers should aim to increase engagement with traders, migrant workers, fisherfolk, pastoralists, refugees, and other displaced vulnerable persons to seek healthcare services to prevent the spread of COVID-19 of members of border communities. And now we will move on to Afshana to present about the COVID-19 cases.
Thank you. Okay, so this section of our exhibit, we will conclude it by briefly touching on some COVID case number details, some challenges faced in light of COVID and vaccination rollout. So according to a statistical model based on air travel from China, Egypt, Algeria, and South Africa were initially identified as highest risk for COVID cases. And the first case of COVID was reported in Egypt. So around May 2020 is when number of confirmed cases begin to increase. So from the graph on the right, we can see that the numbers of cases increase with time, and the highest numbers being reported in May with Western and, as predicted, Southern regions in Africa having the highest cases reported. So to mitigate the growing number of cases at that time, most countries implemented a travel ban and enhanced surveillance at airports and screened passengers that were traveling to China or had a history of traveling to China. And in the map underneath, below on the right, we see the total cases of COVID by country at the end of 2020. Again, you can see that South Africa carries the highest total. So, as of the last month, approximately 3.8 million cases have been reported across the continent and 100,000 deaths since the onset of the pandemic. We're going to move on to some challenges now. So, with COVID-19, the same challenges that African countries, like many other countries, are experiencing are balancing the economy and public health. So, based on our research, one challenge was highlighting the well-being of people and the well-being of economies and growth. And there has been a drop in economic growth across the continent from 3.2% to 1.8% since the onset of the pandemic. And the challenge here is finding a solution that protects households financially while also protecting health of populations through public health measures. And another challenge, which predates the onset of COVID, has been overcrowding and limited sanitation amongst those in urban areas, especially for the urban poor. So, this creates difficulty in physical distancing, isolation periods, hygiene measures, and contact tracing. And improving access to sanitation is of the utmost importance and can help improve this issue. And we'll move on now to vaccination distribution. Um, Along with the health precautions to slow the spread of COVID, Africa CDC has taken on the responsibility of providing COVID vaccination across the continent. According to Africa CDC Director Dr. Nikenga Song, vaccinations have already started in Seychelles, Egypt, and Morocco, and will commence in South Africa as well. So the vaccination strategy is threefold. Number one is acquisition of vaccines, which has currently led to 270 million doses acquired. Number two is coordinating trials across Africa. And the third is establishing the Delivery Alliance. So Africa CDC aims to vaccinate about 60% of the population of the continent as of February 2021. Guidelines are still being developed on how to roll out the vaccine, and these guidelines will, of course, be contextualized based on country-specific needs. So 27% of the vaccines will be provided by COVAX, which is a World Health Organization and Gavi Vaccine Alliance initiative, and it aims to provide fair and equitable access to COVID-19 vaccines. The rest of the vaccines will be procured through AVAT. AVAT is a mechanism, it's the Africa Vaccine Acquisition Task Team. So through COVAX, vaccines are free because they're subsidized by donors, and vaccines offered through AVAT will be supported through the Africa Export-Import Bank and will require that countries secure promissory notes to pay for them. So according to Dr. Nikenga Song, access to vaccines won't be limited based on availability of money. And all these efforts are incredibly important and have been implemented well. And it showcases Africa CDC's high degree of organization. We will now move on to the critical analysis section of this exhibit.
So, why does the world need Africa CDC? So, oftentimes, the narratives produced by international media outlets often perpetuate themes of codependency and incompetency of Africa as a continent. Not only are these harmful, inaccurate, and decontextualized, but they reinforce the white savior narratives and do little to improve conditions within Africa. So, for example, when we look at COVID-19, little discourse in international media showed how African communities have come together to aid one another. So, examples may include youth renting out speakers and riding around their neighborhoods, broadcasting information about the new disease, translators creating services to raise public awareness, people sewing face masks out of fabric scraps and handing them out for free to counteract price gouging. So the whole world needs the Africa CDC as it legitimizes the experience of those in Africa, while Africa CDC prioritizes the needs of Africans using the knowledge of Africans. So rather than waiting for external parties to take action, Africa CDC has quickly and has been able to mobilize task force, secure equipment and materials, and develop policies to address COVID-19 and other disease outbreaks. So in doing so, Africa CDC gives agency to African players and empowers them to revise and account made by foreigners and to ultimately decade Africa's CDC, as evidenced during this pandemic and through our digital exhibit, has been able to produce solutions for Africans by Africans. So next, with multilateralism and with a united Africa, Abby.
Okay, so we're going to be looking at some of the criticisms, the positive ones that Africa CDC and Africa in general have been receiving in terms of their COVID-19 responses. And the first one is multilateralism of Africa during the COVID-19 pandemic. And we could tell by the responses that we've been looking at so far that Africa has really pursued a multilateral approach when it comes to handling COVID-19. And their focus has been on minimizing social and economic disruptions while also making sure that public health responses are enhanced. And as we can see with many of the collaborative efforts spearheaded by Africa CDC, they focused on establishing strong regional and national public health systems in order to respond to the pandemic and particular outbreaks in an adequate and effective manner. As we talked about earlier, the Africa Task Force for Coronavirus is an example and was launched very early in February 2020. And it took on a Pan-African approach in compiling, analyzing, and sharing information, and also establishing a range of measures and policies, which not only had general information on ways how to handle COVID-19, but also had very specific regional analysis in terms of ensuring that certain regions with high risk were treated differently and had different response systems. So a lot of people have considered that the increase of multilateralism is really a reflection of the political ownership and accountability in the continent. And the accountability really supported Africa CDC and its effectiveness in cooperatively addressing the needs of the pandemic. And this is something that has been critiqued for being a lack of in Europe and the Americas. So the next thing that we're going to be looking at is the unity that has really emerged from Africa in times of the pandemic. And despite the increased number of cases and the waves that are ongoing in Africa right now, it's still important to notice that COVID-19 deaths per capita in Africa are actually much lower than the global average, which is really a testament to the unity of Africa. And so like before, the question of whether Africa has the capacity or they have the system to handle and conquer disease and health crises is now a question that is considered far gone. And we can really say that based on scientific solidarity and political unity, the health systems and public health response in Africa, especially for COVID-19, has really strengthened. So just to highlight the scientific solidarity that we just mentioned. An example can be the February 2020 early emergency meeting that was convened along with the task force. The Africa CDC also in collaboration with the WHO created a strategy that really works from the bottom up approach. So they analyzed regions and established high-risk countries such as Nigeria, Cameroon, or Kenya, and ensured that these specific countries and regions had additional resources, whether that was in terms of capacities for testing, trained staff, or procurement of PPE. So yeah, overall, throughout this presentation, we were really able to highlight some of the key responses spearheaded by Africa CDC and its member states, and we've come to the end of our presentation. We just want to end off with a thought or a question for you. Like, what are your thoughts on Africa CDC's COVID-19 responses? Something that has stood out to you or has been highlighted in terms of comparing it with your country, maybe in the global north. Feel free to put your hand up and speak, or you could even put it in the chat box.
I'm not sure if you've seen, but Mira had an interesting comment in the chat, if you wanted to speak to that at all.
Yes, actually, that was from my research that I was doing based on the cases. That was something that also stumped a lot of researchers and doctors as to why South Africa was seeing such high numbers. There's lots of prediction as to why, but there's no real conclusion that anyone has really come to.
I just want to say thank you for this presentation. It's so informative and I've learned a lot. Just one interesting thing that I know about Madagascar, I've worked there before. When you talk about scientific unity, it's really interesting because Madagascar was one of the countries who still refuses to accept vaccines. And they were, I think, together with Tanzania, they were two countries who actually believed in herbal remedies, and they actually promoted a sort of a COVID cure based on herbal drinks. And then now, of course, it's proved to be ineffective. So I don't know what they're doing now with the vaccines and all that. Thank you.
And Anastasia has another question in the chat. If Anastasia, you want to say it out loud, or if one of the group members would like to read it out loud and respond.
I have no problem with saying it out loud. So I basically asked, like, what are some, because you mentioned that there are predictions, but nothing conclusive has come about as to why SA is experiencing the greatest COVID cases, even though it's not the most populous nation on the continent. So just wondering, like, what some of those predictions are.
So according to one doctor, I don't know how to pronounce his name, Mutsavedzi, his theory is that South Africa, because it's more crowded, that there's more of a high infection rate, and it's honestly very little is, from what I've seen, is very much like very little is really backed up by any solid research. It's just musings really at this point.
Just to add to that, when we were making the map of the cases that you saw, most of the raw data that we had indicated spikes in cases in South Africa. Firstly, because, and this is based on like no concrete information, but basically because South Africa has a lot of peri-urban growth. And secondly, if you were looking at the news, the South Africa strain as it came out, I think had a higher infectious rate. It spread more fastly amongst the population. That could be maybe one of the reasons, but South Africa definitely had a larger number of cases as compared to Nigeria, as Mira mentioned.
I want to commend this group for really taking on the challenge of explaining Africa CDC and all of its many tentacles while providing a critical analysis. So it's, it's very easy to only take the perspective of an institution. And I think you've done a really nice job of contextualizing and, finding research that's examining what they're doing. So kudos to you. Oh, we've got a couple of questions here, so I will jump out. Justin, do you want to read it out, or do you want it to be read for you? Maybe someone, or I can read it since I'm on. So around summer, I saw a video with a Nigerian street vendor talking about how the government wants them to choose either die from COVID or die from starvation. I'm just wondering if there was any significant tension between local populations across the continent and the emphasis and strategies that the Africa CDC was using. And just apologizing for arriving a bit late.
I could speak to that,
Yeah,
and then Abisha could take over. From what I understand, they've done a survey across AU member states looking at the public health measures being implemented and social measures, and they found that a lot of people believe that the public health measures were causing civil unrest. And from what I understand, in like slums and smaller communities, they didn't feel the need to really push the public health measures because they didn't want to give them that ultimatum. And a lot of they believe that the community members wouldn't take on the public health measures as well. Abisha, what were you going to say?
Yeah, just going off of that, like there was definitely a lot of tension coming from the local populations, especially like you said, like informal settlements and stuff like that, where these public health measures were to say like social distance and practice hygiene measures and stuff like that. But then their living conditions didn't really accommodate for that, right? So there was definitely a lot of like pushback from local communities in that sense. And also like in terms of like making a living and stuff. So the closures definitely impacted people and there was a lot of tension. Um, but I think that like Africa CDC has just been, trying their best to focus on like testing, monitoring, and that kind of aspect of it. So
I
yeah.
think they should, like, I think the next step would be having community involvement in the decision-making
Hmm.
process and developing public health and social measures. So
Yeah.
you get them to give their input as well.
Yeah.
And Mira's question in the chat sort of nicely flows in from what Afshana ended on, like more community voices within decision making. Skepticism, I feel, is not only something that's present in communities that have, naturopathy background. So, for example, India or even anti-vaxxers all across the global north. Vaccine skepticism exists. And as Afshana was mentioning, it's international health 101 is that biomedicine and biomedical narratives like own hegemonic space, right? And I feel the only way to defeat this sort of skepticism would be to include other sorts of medicine and community health in informed structures that sort of merge with biomedicine, because vaccines do work. We cannot ignore that. But communities, people in power and governments need to look at how community medicine sort of um, takes up a good part of people's life and is meaningful to many people, and to sort of merge that in so people accept it as a public health intervention.
I also think that a lot of like communities, like say in Africa, have been exposed to bad experiences in the past with colonial medicine coming into their spaces and imposing like medical treatments and stuff on them that they were not fully aware of or understood or didn't have enough knowledge on. So I think one of the public health responses definitely should be focused on like a bottom-up approach and making sure that the language and the treatments being used or anything like that um, resonates with the community members. So I think knowledge is something that, like community knowledge is something very important, and acknowledging where their fear comes from is also very important, I would say.
Do you think Africa CDC has the space to work together at the community level or with a range of non-biomedical traditions?
So I think that's why we didn't include much of that in our Africa CDC presentation, because Africa CDC as a newly emerging organization itself has been really focusing on scientific-based, approaches and making sure to just limit and contain the outbreak of COVID-19 so far. So I don't think that they've had a break to kind of see the other side of it and come from a community level. Maybe that's something in the future that could be done when the emergency state has kind of eased. But yeah, I think that's why we didn't really include much of it into our presentation itself.
But just as a side note, if you look at their website, and this is completely biased data, I would say, because it's only their perspective, but their training modules, as we mentioned in the Institute for Workforce Development, it states that they are context appropriate and are made in terms of contextually and culturally sensitive material that is also distributed in ways that are contextually and culturally appropriate. So I feel like they're trying, and there's always room for improvement, I feel.
Or to add on to what Tanya said, I think with Africa CDC, because they are relatively a new organization, I think as they've accomplished more, and for example, even looking at just COVID-19 deaths, they've there are less people that have died than what they've originally predicted the number of people to die. And I think as a whole, their ability, especially during the initial like Ebola outbreak and now with COVID, their management is really a testament and proves to a lot of people that like, hey, like what we're doing is working. And like with a lot of it, even with the director of Africa CDC and just addressing different countries that may have some skepticism towards like vaccines or their approaches, they bring forth like the data they have, though yes, it may be biased in that sense. I think um, as a whole, like Africa CDC is trying to, in that way, like decolonize like African experience with the healthcare system, and we can see that, for example, though Tanya briefly touched on like the work development. Recently, I believe a week or so ago, Africa CDC is um, partnering to train, I think, over 150 biostatisticians and also epidemiologists alongside, I believe it was like London. What was it, Tanya? Like the one of the in partnership with one of the health institutes within England.
Yeah, I do not have details because it's very recent. It happened about like 5 days ago that they sent out the announcement about training modules in collaboration with health institutes within London, if I'm not mistaken. And it's definitely a pioneering project, getting people from the global south trained in contexts and culturally specific materials that come from the global south, and so to try to defeat narratives that have been around for God knows how long.
And I think as a whole too, it was with the European and Developing Countries Clinical Trials Partnership. And I think the hope of this is that they do want to address the severe shortages of expertise in these important fields and to just localize their knowledge in that sense. So rather than relying on these external like professionals in that way, they have their own professionals in their continent. And yeah.
I mean, it really is an extraordinary effort in a very short span of time, and both in terms of, dealing with Ebola, which Nigeria, basically stopped it in its tracks, as well as other countries did. And then also the role of this cooperation and multilateralism, as you point out, in terms of training, the platform for pooled purchasing, vaccine trials, data sharing, et cetera, et cetera. So I guess my question is really, you mentioned in your website that it's now seeking, and it's been able to do all of this with the African Union, and you mentioned that it's now seeking independence from the AU. Could you share a little bit more about that and why that would be a challenge? And I guess we need to, I'm so fascinated. I didn't even realize we're over time. So probably should end up after.
When I was doing some research, I thought it was important to include in it because at the moment they still face some difficulty with building workforce capacity, and a lot of the times they do have to run things by the African Union. They don't have their own. They don't have their own legal capacity. They don't have their own. They're still trying to they're pretty much just an extension of the African Union, and they believe that in order to reach out and have a greater influence, not having to run everything by the African Union, they would like to have their own legal independence. It allows them to, I guess, make policies on their own, get funding on their own as their own institution, and not have to rely on the African Union to allocate money towards them, and overall just have a greater outreach.
Yeah, and I also think because it's a public health institution, interventions need to be time specific, and I think that cuts down on bureaucratic red tape also, maybe is one of the reasons.
Any other questions? I mean, we could go, you guys are such experts, we could go on for hours. But if, does anyone have any other questions they want to pose to our team? No? All right, well, thank you so much. Hands up, really wonderful job and very impressive work, and a beautiful website as well. Maybe they'll adopt your website. All right.
It's really well done. And for those who are still here, we will send out the website and the recording in the coming weeks. So you can go back and share their research and learnings with your colleagues and others who may be interested in case they weren't able to make it today. So thank you so much for
For your time.
You know, I think this has been more coverage of Africa CDC that Canada has seen ever before. You know, I don't think this should be on the CBC website, et cetera, et cetera. And I don't think this has been discussed in any depth in this country. So not to mention much of the global north. So well done.
Thank you.